Private hospitals threaten to refuse NHS patients in a row over the costs. We're going to read into this more from the Times, you guys. Let's go. Good morning, good afternoon, good evening, wherever you are in the world. This is Reganelite here with an article from the Times with a headline that private hospitals threaten to refuse NHS patients in a row over costs. Now, the NHS England has announced plans to cap, that's very important, the total amount each provider can be paid, which the independent sector says makes the government deal unworkable. Guys, while you're here, make sure you hit that like button and share across social media so others are notified of this video. So, there's a part of me that is very skeptical of this story. Then there's a part of me is like, well, this is from the Times. But then there's another part of me is that I can totally accept this premise as well. And it's kind of opening my eyes as to, now why would the NHS be doing this? Why would the Health Secretary Wes Streeting be doing this when the general consensus is that we believe that Wes Streeting is a terrible health secretary and he's not fit for that role, and that we don't think he's in the best place of doing so. So why is he doing this? Why is he capping private hospitals? Why is he capping this here? Now, is this a possibility that they're stopping? Like, because the premise that we have, and this is what's been the premises that have since the government's taken over, is that they were going to use the private sector to help reduce NHS waiting lists. That's what they said. Yeah, that's what they said they've been doing. Now, over the last couple of months, the NHS waiting list has been going down. Whether you want to admit it or not, the numbers are there. You're more than welcome to Google it, to look it up yourselves. But the numbers have been going down. Now, the question is this threat really real from private hospitals? Or is it possibly, just putting this out there, that perhaps maybe this health secretary and maybe this government wants us to less rely on the private sector and maybe perhaps put more into our national healthcare service? Or is this all to do with money? My honest answer is we just don't know. Well, this is coming from the Times. I say they're not as right-wing leaning as like the Daily Express or the Daily Mail. However, it does give me preservations and concerns about it, about the way this has come across in the article, that this is really bad for England, that we're going against not giving private hospitals everything that they possibly need here. Whereas for me, it's like we need to be detaching ourselves more and more from the private sector and relying more on the state running the doctor, running these hospitals and doing absolutely everything it can for patients. Because overall, it's actually better from a cost point of view, as well as a life-saving point of view over time. The less reliance we have on the private sector, the benefit for us all, because nobody wants the kind of healthcare system that they have in America. You really don't. So let's read a bit more into this, guys. So Keir Starmer plans to bring down the NHS waiting list. Risks collapse after private hospitals threaten to pull out in a row over cost cutting. So patients have been given a warning of longer waits, and NHS bosses are saying there will be substantial reduction in treatment as a result of the savings plan. So about 1 million appointments a year in private hospitals may now be withdrawn from NHS patients after the independent sector gave warning that the plans was completely unworkable and would end patients' right to choose where they were treated. A deal with private hospitals was hailed by ministers as the key to the government's plans to hit a target of 92% of patients waiting in less than 18 weeks for a routine operation. Announcing it in January, Starmer said it would be a dereliction of duty not to use the private capacities to bring down waiting lists. Now, we've all established, many people have already established, that you do not need to use the private capacity to bring down waiting lists, okay? You don't need the private sector to do this. We've already discussed this. Under the deal, private hospitals are paid a fixed price, that's fixed, yeah, for treating each NHS patient, incentivizing them to offer services as to many people as possible. Now, however, NHS England has announced plans to cap the total amount each provider can be paid in 2025-2026 to control costs, while stressing that hospitals will still be obliged to accept all patients who choose to treat them. So it is definitely a cost cutting thing there. The NHS acknowledges that some patients would face a longer wait as private hospitals delay treatment to avoid breaching the cost cap, but cited that the need for the NHS as a whole not to spend more than the resources it has available. Ministers have understood to have accepted the necessity for such cost controls. So this is the thing as well. It's just about trying. There is a possibility this could cause problems. I hope it doesn't lead to anybody's detrimental. I mean, obviously, any emergencies and whatnot, this is different. So I'm not sure this is particularly different, but I would say probably minor ones. It's hard for me to gauge this one here because part of me feels like that they are doing this to try to not rely too much on the private sector. That's the interpretation I'm getting from this article, is that they're trying not to rely on the private sector, and this is one of their ways of doing that. This is the interpretation that I'm getting. I know some people may disagree, but that's the interpretation that I'm having here. But I do think this may be more to do with cost rather than actually pulling us away from the private sector over time. So, however, David Hare, Chief Executive of the Independent Healthcare Providers Network, says NHS England proposal to cap the amount of treatment the NHS will fund next year while still requiring providers to accept all referrals sent to them would be completely unworkable and risk government commitments to meet the NHS's 18-week standard for planned treatment by the end of the current Parliament. He added if enacted, NHS England proposals would lead to less capacity available for NHS patients, lengthening NHS waiting times and end patients' choice in all but name as providers are forced to delay treatment to live within the cap, even though there is a capacity available to treat patients more quickly. It is understood that Hare represents the private sector in dealing with the NHS as Walmer Street, the Health Secretary, that independent hospitals will walk away from Starmer's deal, accusing the NHS of breaking it. The deal requires the NHS to offer transparent and fair payments that incentivise more treatment. Well, we don't want to. We don't want people to pay for their treatment. Sorry, hold on. Let me take that back. We don't want private companies being involved with our NHS, with our national healthcare. So, for me, I just want them completely out of our hospitals. Like, I want private health. This private healthcare thing, I want it all to be completely separate entity from our national healthcare service. Me personally, NHS sources stress they have yet to make a final decision on the plans, so they haven't made a full decision yet. And we're open discussions with private hospitals about mitigating the impact. However, local health boards have already begun setting up cost caps to take effect from April, and some have opted to limit payments to $100,000 per company, the equivalent of about 50 patients a year. One of them, Sussex and North Essex, has told providers that payment limits could see a substantial reduction in activity from 2024-2025. Yeah, because remember, private companies are always incentivized by one thing: money. One private hospital source said it's only a few weeks since we were being asked by the government to deliver millions more procedures for NHS patients. Now we're told that NHS England is giving the NHS a one-way right to cap how much they will pay us, while still being able to refer an unlimited number of patients. For a private provider, you simply cannot take on that level of uncapped risk. Private bosses also fear that their payment limits will be set far lower than those imposed on NHS hospitals, threatening to undermine ministers' efforts to boost choice. Treating has stressed the role of patients' choices promoting competition among NHS and private providers, and is planning to extend it to more treatments as part of a 10-year plan due this spring. However, the private hospital source said the cost cap would completely undermine the rhetoric about money following the patients, and that funding only ended up with the most productive providers. The Department of Health said that conversations are ongoing between the NHS England and independent providers. The government is committed to giving patients real choice and control over their care, including the option of being treated by the independent sector on NHS terms. I just personally like. There is a part of me that feels: is the government perhaps looking to less rely on the private sector here, or is this just a small little blip? Is this it, or is this all just down to money? I think I generally think this is perhaps maybe something down to all just for trying to save costs for the National Healthcare Service. I think that might be it. I generally think that's the only reason why they may be doing this. But I do not trust this health secretary, and I do not trust him to do what's best for the health system. That being said, he has reduced health care NHS waiting times, which is what I've said already, as we know. But I personally wish, we weren't relying on private hospitals. I really, really wish we wasn't. But I'm generally curious, what do you guys make of this story? What do you guys make of the decision to put this so-called cap in, if they plan to do so? Because it looks like they're planning to do so based on the article here from the Times. But what do you guys honestly think? Let me know your thoughts and more on this story down in the comments section below. If you found this video informative or helpful to you in any way, please hit that like button. It'd be greatly appreciated, and share this across social media so others are notified of this video. If you haven't subscribed, do consider subscribing. Check out the Patreon and Rumble content for additional content on those platforms. And if you want to financially support me, hit that join button down below to become a YouTube member for as little as 99p. So thank you guys all so much for watching, and I hope to catch you all very, very soon.